Well, Dr. O'Connor, it's a pleasure to have you on the Medical Mindset podcast. It's great to be out here in Arizona.
Thank you so much for having me, Johnathan. And please call me Mary Frances.
Mary Frances, okay. No formalities here.
No.
In Arizona.
That's right. We're very casual here.
Very cool. One of the reasons I wanted to talk to you is because I think the area of your research is very compelling. And I don't say that in like a superficial sense. What I mean is that scientists study all sorts of things, and we're all related to science in some degree. Like someone who studies physics, of course, I'm human. I'm related to the laws of nature and stuff. Someone who studies cancer, maybe I don't have cancer, but maybe I know someone who has cancer. But grief, that's sort of that's an inescapable course of the human experience, I think, which I think makes your research very compelling to anybody, effectively. So I wanted to open this up by asking you what motivated you to study grief. I'm sure you get that a lot, but why devote your life to this study?
I think some of that comes from just the scientific curiosity, not what grief feels like, but why does it hurt so much? And how does it take so long for us to understand what's really happened when we lose a loved one? Mm-hmm. And so the idea that all of that gets encoded in your brain is just fascinating to me.
Right.
But there's more to it than that. When I was young, when I was 13, my mother was diagnosed with stage 4 breast cancer, and she lived another 13 years.
Oh,
yeah, which is sort of, I think of it as a reprieve from the universe, sort of. But it meant that grief visited our house,
Right.
And I feel like I became comfortable with grief. 26 is not as young as some people lose their parents, but younger than many.
Right.
And so it meant that I just felt comfortable with people who were grieving. So I've done hundreds of interviews with people who are grieving, and then we also put them in the neuroimaging scanner. And to be able to sort of map their experience onto the images that we see in terms of their brain activity, I think that's just been really compelling to me as well.
Yeah, I think the story you can tell as a scientist is really interesting. And one of the things that sort of gripped me from the intro of your book is that you don't preferentialize the study of grief from that neuroscientific perspective. It's just the perspective that you happen to take as a neuroscientist.
That's right. And the reason, I think a religious view, an anthropological view, these are all important ways to think about grief as well. Mm-hmm. Neuroscience is sort of the conversation of our times.
Right.
It's what people are talking about. It's how they're thinking about human emotion, human relationship, human connection. And so to look at grief from a neuroscientific perspective can give us yet another piece of the puzzle. And so I'm fascinated at being able to contribute to that so that we keep having this conversation, because it's important to talk about grief.
Yeah, I want to tease apart some of those things with you, because I think the lens that you offer is different than what the conventional ways that we maybe encounter grief, like you were saying, through religion and through stories and relationship and other ways. But I think science is an interesting one. I want to ask you about maybe some misconceptions that people have about grief. In your book, you draw this distinction between grief and grieving. As a layman, I've read your book, so I know the distinction you draw, but if you were to have asked me like a week ago before I read your book, I'd been like, I don't know, one's a verb and one's a noun. Like, right. I don't know what's the difference. So do you mind drawing the distinction for us?
It originally came about as I was studying, as I was trying to design research studies to learn more about grief. And so I did the first neuroimaging study of grief back in 2002 and published in 2003. And so we thought about how are we going to evoke grief, and asked people to bring in a photograph of the person who had died so that we could show them on goggles that loved one as they're laying in the scanner. So we're taking pictures of the parts of their brain that are activated while they're looking at this photograph of the person who's died. Right?
Okay.
And comparing that to just looking at a photo of a stranger, say, for example, where there's not grief.
Right.
And so the important part about that is I came to realize that we were starting to have a good understanding of grief, but grief the moment. And many people are actually interested in what changes over time for people as they're grieving. And so in order to study that, you see, you would have to have multiple neuroimaging scans in order to see the change over time. So while originally it became important to me as a scientist to make a distinction between grief and grieving, it turns out that it's been helpful to lots of people that I talk to because, grief is it's that moment that overwhelms you. It's a noun, right? But grieving, that verb, that process, is how grief changes across time. But it means that grief doesn't necessarily go away. Right? And there's nothing wrong with feeling grief decades after someone really important to you has died. It doesn't mean there's anything wrong with your grieving just because in that moment you feel grief.
Right. I think that's the part that people struggle with, right? It's not so far-fetched to think that if something traumatic happens to you, there's an instantaneous moment of just overwhelming sensations. But how long am I allowed to persist in these feelings? What's normal? Is my brain healthy? Am I processing reality? Am I congruent with reality, what I'm perceiving? So I think those are questions that people struggle with. And I think that's where the neuroscientific perspective kind of slots another piece of the puzzle there. I wanted to ask you, so in your book, you kind of open it up with describing grieving, the process of grieving, as presenting a unique problem for the brain. And I think looking at it that way is so cool. So what do you mean by that? Why is grieving different than some other social phenomena that we face? And why can't our brains quite wrap our heads around what's going on?
Well, I'll give you an example where the brain is very good at learning. Right? This is part of what the brain is there for, is to understand what's happened and what might happen next, right? To predict. It's a prediction machine in a way. Well, let's take, for example, if I'm teaching a class in fall semester, and students usually sit in the same seats, every time they come in. And so I get used to who sits where and, who has a brother who talks a lot, At the end of the semester, they all go away. And in the spring semester, I don't expect them to show up in those same seats, do I? Right? That would be silly. Exactly, right. Assuming they pass the class. I learn almost instantaneously that they're gone and they're not coming back. The death of a loved one, a person to whom we are bonded and attached, is a very different learning process. And here's part of why. When we fall in love with our baby or our boyfriend or girlfriend, a bond is formed, and that's encoded in the brain. What that bond means is there's a belief that comes along with it in that encoding that says, you will always be there for me, and I will always be there for you. That is a belief that is just implicit. Otherwise, how could you go to work every day, right? Send your beloved off to work, unless you knew at some very deep level you were going to come back together again at the end of the day, right? So when a loved one dies, when someone to whom we're bonded dies, our brain doesn't immediately begin predicting that they're not going to show up again because of this deep implicit attachment belief that they're out there and that we should persist in believing they're out there because it is very adaptive when they're alive to believe that. So on the one hand, you have these memories. You were either present when your loved one died or you were at a funeral or a memorial. So part of your brain has these memories. It knows the reality. But there's another part of your brain that maintains this attachment belief. And I think that it's because those two things can't both be true, that's not possible, that it actually takes a long time for the brain to begin to predict absence of this person. This is why you pick up your phone and start to text and then realize that you can't, right? Because you're using these two pieces of information. So I think the learning part is really understanding, what does it mean that my loved one is gone? And how do I change my understanding of the whole world that will not include them now or tomorrow or tomorrow or tomorrow?
Right. I think you used a couple of really interesting words there. You mentioned grieving as a process of learning. And then you also used a more scientific term where you said it's adaptive to believe that the relationship will persist. And I think most people are rational enough to understand that relationship in its earthly sense no longer exists. Of course, your mother or your father who's passed will always be your mother or your father.
Yes.
Your lost loved one will always, that love still exists.
Yes.
But in the way that it existed in the past, we know that that relationship in the way it's existed can no longer exist.
That's right.
So why do these beliefs persist? Even though, rationally we can tell ourselves, no, well, they're gone now. Okay, it's not appropriate for me to think about these things anymore. Where does that come from like a science standpoint?
I think for me, the interpretation I make, right, is that when we have a relationship with someone, it's really as though we're sort of in two worlds at the same time. And what I mean by that is you're having a relationship with the person in their material sense, right?
Yes.
But when you have a relationship, you also are constantly thinking about them in your mind as well. There is a virtual version of them. So for example, let's say somebody steals your girlfriend's phone and texts you, right? If they text you and it doesn't sound like your girlfriend, you know immediately, right?
Yeah.
Because what's happening in the world doesn't map on to who you know that she is, right? And so all the time, when the person is alive, we have them both internally and externally.
Right.
This is similarly, you think about in the middle of the day, you're suddenly thinking about, I wonder if my dad had that meeting he was supposed to have with the lawyer and I should call him, right? We're getting these constant notifications, push notifications from the brain, right? Because it's so important, this relationship. So our brain is constantly thinking about them. When they die, just as you say, they are no longer in the material world, but that virtual relationship continues. There's nothing about your brain that suddenly changes. It can change over time as you learn, but just as you say, you really have to transform that other world that you're walking around in to make sense of the material world as well.
Right. You use the phrase push notifications. I think it's funny because I think it captures the experience very well in that it's not like I'm voluntarily sitting there all day long, like ruminating over my girlfriend who's, I don't know, at work or doing whatever she's doing, right? But it's this idea that love or that relationship persists so deeply within me that I can't help but think about her in a positive way, in a caring way.
Yes, that's right. It always, that security that you have that relationship is in the background.
Right.
And even if I asked you right now, if you needed to get to your girlfriend, where is she and how long would it take you to get there? That's probably pretty easy. Right. You know exactly what I mean.
Yeah.
You probably know exactly how you would get there and how long it would take or when you'll see her next. And I think when a loved one dies, it isn't that they're lost. It's that there is no longer a here and now. There is no longer a place in the world where they are and a time when we will see them again. Mm-hmm. So it isn't that, it's that the dimensions don't exist, not that they are just lost.
Right, and that's hard for us to compute, given that we live in like a material reality.
Yeah.
I think that's interesting because what you're describing is sort of unconscious behaviors that I don't think you can consciously tell yourself to rid. I mean, maybe you can use that as a strategy to like provoke yourself to, bring your attention back.
Yeah.
But it truly is a process of learning. And I think as animals, we sort of evolved to develop a really good spatial model of where we are and where important resources are. Yeah. Do you mind speaking to that in terms of how do relationships map onto our brain? In terms of, I implicitly know that food, brighter colors indicate really good food, and I've evolved like as a human to know these things. Yeah. But is there any reason to believe that our human relationships map onto our biology?
I think that there is. And I think in addition to these two dimensions we were talking about of sort of time and space, where are they and when will I see them next?
Yeah.
Part of what's so unique about primates who, bond with each other and have sort of long caregiving relationships, namely humans and a few others. But part of what's unique is I believe there's a third dimension there that helps to predict that attachment, that helps to predict they are out there and I will see them again.
Yeah.
And that dimension, other than space and time, is closeness. And so the sort of concrete example is if I say, hey, are you and your brother close? Whatever you're doing right then to determine if you and your brother are close, that's the dimension I'm talking about.
I'm lamenting my mom for not giving me a brother.
Fair enough.
Yeah,
okay,
yeah.
I could say, are you and your mom close? Right.
Yeah.
But the point is, that sense of closeness, which transcends whether you just had a fight or you're annoyed with them about something, that sense of whether you are close predicts that you will see each other again, right? If you are close with someone, you're going to see them again. And so I think the important part about that, there are some neuroimaging studies that suggest that dimension of closeness between people is mapped in the brain in a very similar way to how far apart are we physically, or how far apart will it be till we see each other next, which is just a fascinating thing in and of itself, that closeness could be a dimension. But I think it really helps to explain something people really struggle with when they're grieving. And that is, many people while they're grieving either feel a lot of anger or a lot of guilt.
Right.
And that anger, it's hard for them to explain, but often they feel angry with the person who died.
Yeah.
And I think if you think about it from the perspective that in your mind that relationship is ongoing, what it means is that person just disappeared on you. Someone with whom you are very close just stopped responding. Well, that would make me angry, right?
Sure.
Or I would feel really guilty. What did I do? Why aren't they coming back to me? Is there something I could repair to help them come back?
Yeah.
Now, you're not consciously thinking about it that way, but I think it makes sense that because that closeness dimension is still sort of acting in the same way that you might try to text them because you sort of have this feeling they're out there, you might also be trying to sort of repair the relationship because you still feel that they should be close to you. Does that make sense?
That does make sense. And I want to ask you, so I think what you're describing, to me, it sounds like something I've seen in other people. I've experienced loss in myself. I've experienced it in my own life, in the lives of family members. That sort of behavior, in my anecdotal experience, seems normal.
Yeah.
But it doesn't sound rational.
No.
So asking a neuroscientist, is that normal behavior?
It doesn't seem rational at all.
Right.
I think people really struggle with, why am I looking for this person in a crowd? That's a crazy behavior.
Right.
Or Joan Didion, in her book, A Year of Magical Thinking, wrote, I couldn't get rid of my husband's shoes because he might need them again. Right? That's completely irrational. But I think if you understand how attachment neurobiology works and the beliefs that are deeply associated with it, then it starts to make a little more sense why you are doing these things, thinking these things, feeling these things. And by enabling yourself to feel a little more normal, to understand that you're just on a learning curve, I think it gives us a little more self-compassion about why it takes so long, and that you are continuously learning. You are living your meaningful life now too.
I think that makes a lot of sense. And I think people can justify it if you lose a parent or a romantic partner or a child, like God forbid you lose a child.
Yeah.
I think all of those reactions, even the most extreme, it's understandable. But what about in the example of people that you don't necessarily know? And by that I mean, like, let's take Michael Jackson. I vividly remember where I was, what I was doing when I found out he passed away.
Yeah.
And I mean, I like his music, but I don't know anything about him, nor does anyone I know him.
Right.
Yet that memory is so salient in my mind.
And you might have even felt grief.
Maybe among friends who also liked him, oh man, we didn't get to see him. So there was that, and I was a child, so I just thought that and in reading your book, I'm like, is that normal?
Right? No, it's a great question. I think there is a way to explain that. when Princess Diana died, a
Right.
lot of people experienced really strong grief. And you think, well, are they just being overly dramatic? What's going on there? I think that I was describing that you have to have this attachment bond in order to feel grief later, right?
Yeah.
But if you think about it, many of the artists or authors or actors that we are viewing over and over and over again, they often say things in a way that describes exactly how we feel. And so what I mean by that is, it's like they understand you.
Right.
Right?
Right.
And so it feels special because, Michael Jackson has a vibe that's very different from some other musician, right? And you're connected with this one. I think that is a kind of bonding that happens, even though it's only in that virtual relationship,
Right.
and can cause real grief then. It also means that you sort of lose a piece of your life when that artist was really important to you.
True.
So that childhood, those times you remember listening or sitting around with your friends, there's a piece of you that's kind of lost then when that artist dies.
That's true, I think that's a phenomenon that's taking place in interesting ways now. Just given that we have so much access to content and other people, that a lot of people are forming these parasocial relationships with creators and things like that online. And when they stop posting or something, they feel like a deep sense of loss, belonging, which I think is an interesting phenomenon. But it is a human relationship, even if it's one-sided.
Yeah.
Right. So you're a clinician as well as a researcher. And you look at grief from a scientific perspective. So I wanted to ask you about normal or healthy, because I think you're in the business of normal and healthy. And I think a lot of people, when they're going through periods of grieving, struggle with feeling like themselves. And then they go through that, am I normal? Is this grieving process healthy?
Yeah.
So where do you draw the line there? Because rumination and guilt, and loss of daily function and things like that, they can be normal for a certain amount of time. I think everyone can acknowledge that. But when does it border on the line of maybe there's something more going on here?
Yeah. I think you're absolutely right, especially in acute grief. We just sort of want to know, when is this going to be over? It's really, and am I normal? Could the most intense feelings I've ever had, how could that possibly be normal?
Right.
People don't necessarily realize that there isn't a set trajectory. So I can give you this as an example. People will say, when am I going to get over this death? So you could think about the analogy to the question, when did you get over your wedding day? Which is not really a question that makes any sense.
It's almost the inverse question.
Exactly.
Yeah.
And it is because this event has happened that completely changes you. So are you a normal husband? That's not really a question, is it? I mean, There are points at which we recognize people have sort of strayed outside of what is typical. So it's not that we can't look at a particular husband and think, oh, he's really struggling with avoidance, or he's really struggling with alcoholism or something.
Yeah.
Similarly, I think you can work with a person who's bereaved and recognize, wow, they're spending so much time avoiding situations that remind them of the loss that it's really impacting their ability to function day to day. I can give you an example of a woman whose daughter had died.
Okay.
And she described it as sort of, she'd put herself on a treadmill. She would get up, she would go to work, she would come home.
Oh, I see, okay.
And that was it. And she couldn't go out with friends. She didn't want to listen to music, right? All of the things that sort of are the other meaningful activities in life, she'd begun avoiding those completely. Mm-hmm. And so what's good to know is that there are psychotherapies that can help us to get back on that typical grieving trajectory. Not to take grief away, because we said earlier that's not a thing.
Yeah.
But to make sure that this person still feels like they're learning how to be in life now. who am I as a person who has lost my daughter, for example? And
Right.
what do I want to do with my life that I still find meaningful?
I think the grieving process is interesting, and I'll speak from personal experience. Like when my father passed away, you're met with like a lot of condolences and whatever, and then eventually, you're planning a funeral and all those things, and then you get bombarded with all these services, and counseling, and they're all part of the health system trying to solve a problem that they recognize as a real problem.
Yeah.
But all of these resources sort of imply that there's a right way of doing things.
Yes.
I don't know the stages offhand, but it's something like, regrets, guilt, denial.
The
something.
Kubler-Ross stages, yes.
Yes, from your book.
Yes.
But, and then it kind of concludes in like acceptance, and then you sort of like move on.
I'm done.
Yeah, and then it seems very like stepwise, and there's like an uphill, and you're supposed to do all these things. And I'll say like firsthand that I didn't necessarily do all of that in that order.
No.
And I feel okay from that.
Yes.
Is there merit to that? Like,
It's a great question.
Yeah.
I think a lot of people know sort of the 5 stages of grieving.
Yeah.
It's very incorporated in our culture. And I think here's another place where grief and grieving, making that distinction really helps. So Dr. Elizabeth Kubler-Ross was an amazing woman who had this revolutionary idea that you could talk to people who had grief, right? And that you could actually ask them how they were feeling, which was not done at that time. And really, she did what scientists always do at the beginning. She described the phenomena she was seeing. So many people who have grief show it in signs of depression, or people show it in signs of denial or acceptance, right?
Yeah.
So if you think of it as just a description of what people experience when they have grief, I think it works great. Where it became problematic is when it was taken as a set of grieving prescriptions, as though it happens in a linear order.
Right.
Everyone experiences all of these stages, which is just not how people experience grieving usually. And so you are completely normal, typical, even if you never felt anger, for example.
Sure, yeah.
I think what becomes problematic is when people assume that there are some rules about how to do it right, and they worry that they're not doing it right. That mismatch is actually often more problematic than the grief itself.
Right. Well, where does it become like troublesome when you're looking as a clinician? Because of course there's no way of doing it right. Everyone has unique relationship with the person who has passed. It's context specific. We're all unique as individuals in terms of our personality structure and all of those things. But as a clinician, you must look at certain patients and be more encouraged by them doing better. And then other ones where you look at their behavior and think that if we don't correct something, this could continue to be pathological.
Yeah. So one of the things that we know is when grief is impacting your ability to function, right?
Okay.
Your ability to get dinner on the table, your ability to get your kids to school. When it's impacting you so that you're drinking all the time as a way to cope with how you feel. Those are signs that the grief is not changing over time in a way that you're able to manage. And importantly, gives us sort of entries into how we might help. So there are a set of criteria that we use for prolonged grief disorder. And it isn't just sort of a laundry list of symptoms. As a clinician, you learn how to diagnose and how to make distinctions. So things like, is this typical for this person's culture, right? So right? Yeah. So grieving looks very different among different people, doesn't it?
Yeah.
And so the idea that there are these symptoms, but also there's this functioning difficulty for this person, that's when we start to be concerned. And we don't even start to try to say this is prolonged grief disorder until a year has passed, because that first year is usually so chaotic for people emotionally.
Do you have an example of that, where those cultural differences create different normals? Because I think that's really fascinating, that depending on where you are and sort of what's normal there, that grieving process can look different. Yeah,
absolutely. So I'll give you an example within our own culture. So imagine you have a good friend. You have a good friend whose daughter died.
Okay.
And suddenly now this woman only wears black. And she has a photograph.
Well after the funeral?
Yes, well after the funeral.
Okay.
She has a photograph of the deceased child that she has up in the living room.
Oh, like, so the child after?
Yes, right.
Okay.
This to you or I would probably seem very disturbing, that this woman is really quite disturbed.
Sure, yeah.
This was a very traditional thing to do in the 1800s in the United States, to have photographs of the deceased loved one around so that you could see them. And so this is an example of where at that time, there was nothing dysfunctional displayed by expressing your grief that way. That was a thing that people did.
Right.
But now, if it was happening, it would look so bizarre to us that we would actually think, this woman needs help. This woman is having a problem.
Yeah, I'm trying to wrap my head around that example.
Right?
It's a bit out there.
It is. And so this is a great example where that's even American culture, right? We haven't even gone to another country.
Sure.
And yet this grief expression is so different in that time and culture that to us, it would just seem bizarre. Here's another example.
Okay.
Let's say you have a good friend whose husband died.
Okay.
And 6 months later, she marries his brother. You might think, okay, that's super weird. But in many cultures, that's actually pretty typical. Right? So you can see how if you take culture out of the picture, you're not necessarily going to accurately understand this person's expression of grief.
Okay. I think that's important, especially as a clinician, where you're saying you have this diagnostic criteria, but we don't even really look at it until a year.
Yeah.
And then we have to consider the other things that are involved as
That's
well.
Right.
So when you're saying diagnostic criteria, so prolonged grief disorder, that's a diagnosable phenomenon. Like
Yes.
that's, okay. So that's categorized in the DSM-5?
It is. It was recently added, and it's been in the ICD-11, the International Classification of Diseases, which is the one put out by the World Health Organization, for several years now.
Okay. So now that's a diagnosable disorder.
Yeah.
I think that's interesting because grieving is a normal process, but then that implies that it can get pathological and it can become more than that, something that needs to be treated.
Yeah.
But from my understanding, not everybody goes down that route, needing that level of treatment to sort of overcome this prolonged grieving, where it becomes a disorder. So what separates those people, or what makes them predispositioned to going down that route that maybe other people, they can reach acceptance and build new relationships more easily? Why don't some people get to that?
Yeah. We know from research a few of the predictors. So as with all of our mood disorders, women are more likely to develop prolonged grief than men. That's true with depression as well, and anxiety.
Really? Do you have any sense as to why that is? Like, is the literature saying anything about that?
There are lots and lots of reasons, both cultural and probably, there are lots of reasons.
Yeah.
But we certainly know just from research that it is true, for starters.
Okay.
But we also know that people who have had other attachment relationship difficulties in their life also are more likely to develop prolonged grief disorder. So someone who had a parent die when they were a child, or had separation anxiety as a child, right? Where where you can't bear to go to kindergarten, that sort of thing, and be separated. So I believe it's possible that there are even biological differences between people, potentially even in their brain, that may make it harder for them to understand and update what has happened and to not feel such intense anxiety around the fact that this person is gone. Now, there can also be lots of other reasons. It doesn't have to be biological, but I think that part of my interest in the brain is really trying to find out, how does that bond happen neurologically?
Yeah.
And then is there anything about the neurological aspect of that looks different in people who aren't coping well?
That's what I'm interested in, because, and you talk about this in your book, but just even listening to you speak about this here right now, I think that's a bit of a slippery slope in that, especially when you're going through a trying time, it does give you a little bit of an out, right? To sort of, I don't want to say it's not about being weak, it's about not addressing maybe the areas of your life that might need more attention.
Yeah.
Whereas if you can externalize it as a disorder, then it kind of minimizes that level of, I think it takes away your autonomy to a degree.
I think that's a really interesting thought. And, there's some both philosophical pieces in there and also mental health pieces in there. But let me put it this way. Let's say you have diabetes.
Mm-hmm.
It's going to help you if you take insulin.
Yes.
Now, it is possible that you could manage your diabetes entirely through diet.
Yes.
So by taking insulin, are you taking away that person's autonomy?
Right?
Very cool. It's not a perfect analogy, but you see what I'm saying, right? So let's say, for example, let's pretend.
I don't mean the insulin per se. I meant the labeling of it. That's what I mean.
Yes, I see.
Right?
Now I see what you're saying.
Yeah.
So I think there are several ways to think about that.
Okay.
Part of what happens here is we wander into the territory of mental disorders have stigma that come along with them, regardless of which disorder it is, right? So we're using grief as an example, but in reality, I think we could be talking about depression or we could be talking about PTSD, right? The question of whether giving them a label has somehow changed their need, their desire, their requirement to make certain changes. So let's say, hypothetically, because we don't have evidence for this, let's say that I'm a person who has prolonged grief disorder.
Okay.
Let's say in my nucleus accumbens, I have more oxytocin receptors than, say, you do. You're coping more resiliently, I'm coping less resiliently, and there's this difference in the amount of oxytocin receptors in my nucleus accumbens.
Okay.
Let's pretend for a moment. The reality is, I have to cope with the fact that I have less oxytocin receptors, that I'm going to be overwhelmed more often with waves of grief. That this is true does not mean I can't learn how to manage that.
Right.
And decide how best to create a meaningful life, even while having more waves of grief.
Right. That's a very good example, I think, because I think if for someone who's going through that, who thinks, oh, well, the person to my left and to my right, they seem to just be just fine. Like there must be something wrong with me.
Yeah.
And whether there is or not, if there is a biological underpinning there, I think it would be important to know about that so you can treat it better.
Yes, exactly.
And I think that's really cool.
Because, one of the reasons I think it's so important that we have this, that we have a particular set of criteria and also that we continue to do research is, for example, antidepressants don't help with yearning, right? So people
what do you mean by yearning?
Yearning, that wishing that the person was back. Just if only they could be back, everything would be okay again, right? So people can become depressed after the death of a loved one. And we know from research that in those cases, antidepressants can be helpful. But antidepressants aren't necessarily, from the research we have, going to address the core grieving symptoms. So there's this distinction that we're able to make. And I think a piece of that is probably neurobiological. So our frontline treatment right now is psychotherapy intervention for people who have prolonged grief disorder.
I want to tease apart two ideas with you. So you gave me the example of having more or less oxytocin receptors.
Sure.
Can we start there?
Mm-hmm.
So is in terms of there being a biological basis for some people being more likely to experience prolonged grief disorder, how does oxytocin play a role in that, and how do our hormones regulate that, receptors, areas in the brain? What is going on there?
Well, to be honest, we're in the infancy of understanding this.
Sure.
So we know that attachment is an important bonding hormone. We know this because that's how nursing works, for example. Mm-hmm. There are big oxytocin changes that happen both after a woman gives birth, but then also throughout the day as nursing needs to happen and not happen. So we think that oxytocin is also involved in the breaking of that bond as well, but we are very unclear in what way.
Oh, okay.
So it's sort of, we can point to the system. We see changes in this system, both in animals when they're separated from a pair bonded mate and in humans, but it doesn't mean that we understand either how those changes are happening, which changes are worse than other changes, or even what to do about it. So for example, even if it's the oxytocin system that's being very affected during grieving and potentially more affected in people who have prolonged grief, it doesn't necessarily mean that the answer is to give them oxytocin.
Right.
And part of the reason for that gets back actually to this question about having a virtual relationship.
Okay.
So let's say, for example, that oxytocin is part of the bonding hormones that helps us to create relationships and strengthen, maintain relationships. Let's say that I'm a person who has prolonged grief disorder and I'm spending all this time thinking about my loved one.
Yeah.
If you give oxytocin, let's say you're also a bereaved person and you are coping well.
Sure.
Let's say we give you oxytocin, that might motivate you to strengthen bonds with living loved ones or even meet new people.
Okay, positive.
Positive, yes. Let's say we give me oxytocin. One possibility is I spend more and more time thinking about my loved one.
Really?
Right? Because that's the relationship that's being strengthened.
Oh, I see. You're
because
reinforcing
that's
it.
the one in my mind. Does that make sense?
Yeah, that makes sense.
So I think we will need a lot of research to really understand what's going on, not only at a basic science level, what's going on with attachment and bereavement, but also what is actually an effective way to treat it. And given we have psychotherapy that works, to me it seems like we should be going with that as a way to treat it.
Yeah, I want to get into that because you mentioned a couple things that I thought were really interesting. So you mentioned that we have all these depression medications that are good at handling those symptoms or managing them, whether they're good or bad, you can debate that.
Sure.
But then there's these unique grieving symptoms that are distinct from depression symptoms that cannot be treated with the same medication.
Yeah.
And as you mentioned, that we're still kind of teasing that out in the science. So we don't understand the underlying biology well enough to develop medications for that. Fine, we can park that and put it aside. But we do have these other solutions that are effective.
Yes.
And you mentioned psychotherapy.
Yeah.
So what's going on there when you bring someone in who's following a loss that they just can't seem to get over?
Yeah.
What does that treatment look like?
One of the best treatments we have so far is called prolonged grief treatment, and it's developed by Kathy Shear at Columbia University.
Mm-hmm.
Kathy Shear really uses this model that a lot of us use to understand grieving, which is this idea that there are really two kinds of stressors that a bereaved person has to deal with. On the one hand, there's the stress of all those emotions and thoughts and how just the pain, the overwhelming pain of this person being gone, what we traditionally think of as grief. But there's a whole other set of stressors, which is, how am I going to restore my life now, right? So everything from, I've never balanced a checkbook before, that was what my wife did, and so now I have to figure out how to do that. Yeah. Everything from that to, I've always been going to retire with this person. What does retirement even look like if this person isn't there? All of those things about how are we going to restore our life now? So you can end up having difficulties with either of those stressors that you're trying to cope with, and sometimes both. Mm-hmm. And so the psychotherapy really breaks that down into very small pieces and very small skill sets that we can help and encourage in a therapeutic relationship people to engage in. So for example, helping the person to develop things they think might feel meaningful as activities, and then encouraging them to do an experiment. Try going to dinner with your friends, even though your husband won't be there, and see how that goes. Part of why it's helpful to do that in a therapeutic relationship is, to be perfectly honest, the first time, it's going to stink. It's not going to be great. And you're going to come home and think, why did I do that? But in the therapeutic relationship, you'll be encouraged to do it again. And the second time you may think, that did not go well. But I did have an interesting pasta I'd never had before. That wasn't so bad. There's a slow upward spiral as we start to re-engage in our life now and discover what feels good and what doesn't, who we are now as a bereaved person. Yeah,
I think one of the most challenging parts of grieving, and then I almost slipped and said it, like finding yourself again.
Yes.
This idea that your identity is so tied up with someone else. And then to go on as your own person is scary.
Yes. Well, and you think about it, it really is a lot about understanding myself without this person. So here's an example. Even the words we use, You are probably a son, I'm a daughter.
Mhm.
I use that term to describe myself, daughter.
Yeah.
But that word implies two people.
Right.
The word spouse implies two people. The word mother, all of those words, although we're using them to describe ourselves, they're actually about two people. And so it's this question of, what does it mean to be a widower instead of a husband? Who is that person? How does that person interact in the world? And so there's a lot of change that has to happen around, what is even my sense of self like now that
Right.
this has happened?
So when you're saying like to go out and do things that you find meaningful, to foster better like other relationships
Yeah.
outside of this meaningful one that you just lost.
Yeah.
Does that mean, so if you're a widow or widower, that you go out and you try to put yourself out there again, or does that mean like how do you know if you're forcing it? Is kind of what I'm getting at, because I imagine, I mean, I haven't been in that situation that I'm describing, but I imagine that would be incredibly uncomfortable. But for some people, it creates a new chapter in their life that is, I don't want to say more meaningful than their previous life, but just as meaningful.
Yeah. I'll start by saying that I may be an expert on grief, but I'm an expert on grief on average. Each individual person is an expert on their own life, on their own grief.
Right.
And it is really only an individual who can determine for themselves how to spend their time, who to spend their time with, what is meaningful to them. For one person, it may be incredibly meaningful to spend time alone thinking about this person creating incredible art, right? We wouldn't have the Taj Mahal if it weren't for the fact, right, that this
Right.
loss had happened. So I'm not suggesting that there is a one-size-fits-all, but I am suggesting that doing some experiments can help you to overcome avoidance that's preventing you from engaging in life now. So I'll give you this example. I think of this as an example of mental health.
Okay.
So I was interviewing an older man, lovely older man, who told me the story about marrying his high school sweetheart. They had 2 kids. I'm sure there was a picket fence in there somewhere. And then he told me that she had been diagnosed with breast cancer, told me about caring for her while she was dying, got really teared up, told me that she had died. And then he was telling me, this had been maybe 3 years ago or something, I can't even remember. He said that he had started going to dinner with this woman who was very different from his wife, but that he was kind of enjoying these conversations. It brought out something really different in him, and he just was feeling more energized. And he looked at me and he said, you know, the thing is, it was really good then, and it's really good now.
Wow.
And I think for me, right, that's
Yeah.
the piece of the flexibility that really helps us to feel mental health.
Wow, no, that's beautiful.
Yeah.
I almost don't have words to respond to that, just because it's not about better or worse or creating this new life that's just so beyond, the one you were living with someone else.
No.
It's sort of establishing a life that you're happy to live.
That's right, exactly.
Which I think is so challenging. You mentioned the word avoidance, and I think whenever we go through things that are overbearing in life, that can be our natural inclination, right? Because it's uncomfortable to sort of sit there and think, well, I'm alone now.
Yeah.
Oh, well, I guess Friday date night is no longer a thing.
Yeah.
Oh, well, I guess so-and-so, like that person's not there anymore. Well, like, boo-hoo, right? And those are all valid. But how do you overcome like the temptation to just avoid and suppress? And what are the consequences of doing that for too long? Because I think a little bit of that is probably normal.
Yes, absolutely. I think grief usually comes with some period of withdrawal. I think that's completely natural. Not for everyone, I should say, but for many people, it comes from this just disengagement, this I can't bear being with people. I think a lot of what happens is we have support. We have support from the people around us, and they often encourage us, they engage us, they love us, they support us.
Yeah.
And through them, we begin to re-engage kind of just because it happens.
Right.
We know it is vitally important to have social support in order to grieve, so that it helps people when they have others around them that can, get in the way of the self-blame or encourage them to do new things or just love them and say, look, what you're feeling is normal. Don't worry about it. You're not always going to feel that way. So lots of different ways that we can provide support, but we know that support is really important.
Yeah, I think that's such a good point. And it's so human. It's so normal. Like, in some sense, you almost don't need science to tell you that, right? It's very innate to who we are. It's how we've progressed thousands of years as a species to get here. It's in communion with each other. This is something I only really experienced firsthand when I experienced loss so closely. Is for lack of a better phrase, I think a lot of people are really bad at helping other people.
Absolutely.
And it's not their intent is not bad. Their intent is great.
Yep.
But there's this uncomfortableness.
Absolutely.
There's this distance.
Yes.
Where I don't know what to say, how to say it. Yes. Maybe I won't say anything, right. Or they say a little too much.
Yes.
So as a clinician, you're very good with your words, naturally. What does a grieving person need to hear?
I will say first off, it is hard to be with a grieving person. I will tell you, I've been doing this a long time, and I say the wrong thing all the time. And then I try to realize that I've said the wrong thing, and I say, hey, that probably didn't sound right. Let's start over. Or let me tell you what I kind of meant by that.
Yeah.
So the first thing to know is it's really anxiety provoking for a lot of people to be with someone who's in a lot of pain, who's suffering, right? And I think part of the reason that it is so difficult to be with that person is because we think that our job in providing support is to cheer them up. But that's not really our job. Our job is just to be with them as they're figuring out who this new person is who apparently has huge waves of grief that come on unexpectedly. The point is just to be with them in that. I think that saying, I don't know how you're feeling, but I want to be here for you. And if you want to tell me about it, I really am just going to listen.
Yeah.
I don't have necessarily any advice for you unless you ask for advice, right? I think there's a way in which a good friend of mine whose son died when he was an infant, a pretty tragic loss. She says, we think treat others the way you would want to be treated. But actually, the platinum rule is treat others as they would want to be treated. This requires first finding out how they want to be treated.
Right.
Is it that they just want to go to the movies and not talk? Is it that they want to go through a photo album with you and tell you about all the travels they took with this important person? Is it that they need help cleaning out a closet, right? Finding out what is support to them and then providing that. It takes a lot, but that is true support.
Yeah, I think those are such good examples because all of them look so different. They're all so contextual.
Yes.
I think a lot of times people feel compelled to relate to the person experiencing loss by sharing something from their own life. And maybe that could be helpful sometimes, but I think holding space in the way that you're describing can be very powerful.
And I think to the degree that we might think grieving is a form of learning, it can also be about what is it like now and how has that changed? How is it different now than it was a month ago, right? Because I think helping people sometimes to reflect on whether there are changes can help them to see that, maybe it won't be exactly like this forever. Because that's the fear, that you will be overwhelmed forever by this intense grief.
It feels like that.
And so saying, I don't even know how to help, but I'm telling you, I will be here because I can see a future where this isn't how you feel. And I will be here with you until you get there.
Yeah. Just in the interest of time, I'm going to ask you one last question because I think your perspective is so unique because you research as a scientist, but you also sit with people as a clinician and as a human, and
Yeah.
you go through your own life and
Yeah.
experience grief and loss and love and all those good human emotions. Is there anything that you can offer the public about grief, in that it's so integral to the human experience?
Yeah.
You're not going to escape it.
Yeah.
But is there anything that you can offer? I think you've offered so much like sense of hope.
Mm-hmm.
Do you have anything else from your work or your life experience that maybe people who are grieving or are fearful of like having to go through in the future might benefit from?
I think one of the things that has most struck me is we get very stuck in my grief.
Yeah.
And in reality, it is grief because we are humans. It is human grief. It's not my grief, it's human grief. And when we start to see it that way, we recognize that actually we're connected to everyone else who has ever loved and lost, right? Which is both people we may meet now, family members we know of who grieved, authors who can describe their experience. I think to the degree that we remember this is human suffering, it can create a point of connection in a moment when you're feeling very alone.
Yeah, to feel as though your experience is part of something larger.
That's right.
That's amazing.
Yeah.
It's very poetic.
Yeah.
Thank you so much for your time, Mary Frances.
It was
It's been a pleasure having you
here.
on.
Really good, interesting conversation.
Likewise.